Hi, I'm Jamie Kelton, introducing you to Megan Carver, an incredible stunt woman in film and theater.
Hi, my name is Megan Carver. I am an actor, audiobook narrator, and stage combatant. A couple years ago, I came to Dr. Okubadejo with some neck pain and got disc replacement surgery. It's one of the best decisions I've ever made.
Today, she'll be telling us all about her experience leading up to surgery and how she's been doing since. Being an actor, being on stage, having your body as like your main tool that you're using, why is spine health so important to you and what you do for a living?
Yeah, so spine health is really important for anybody, to be honest, but especially in performing arts because it is such a physical medium. Whether you're doing film or TV or theater, let's face it, you're probably going to, at your very basic, be moving across the stage with intention. And if you're in some kind of pain, that's going to come across in your performance. So having basic solid spine health is really important. When you're doing something like I do, like stage combat, it's even more important because you want to make sure that you're taking care of your body so you're able to do the moves time after time after time. You might be on set doing a move, simple punch, but if you're doing that 8, 12 times. So your hand is gonna come right here. It looks better for camera if you do this way because then we see your entire fist.
Right. Yeah. I've never done this before.
I know, it's really fun.
Tell us about what you were feeling leading up to your call and then your consult and assessment with Dr. Okubadejo.
Yeah, so before I met with Dr. Okubadejo, I was noticing a lot of pain in my shoulder and in my neck. I would wake up with a stiff neck. I would go to sleep with a stiff neck. I also noticed shooting pains going down my arm, and even sometimes when I would be editing, my hands would start to tingle and fall asleep. It wasn't until actually I had a moment that I was driving and my right hand just kind of felt like it stopped working that I thought, I really need some help. So I had seen a couple of other specialists before I met with Dr. Okubadejo, and I just really liked him so much more because it was a more collaborative process. So I met with him and we talked over my options and figured out a really great game plan.
Megan, what were your concerns when Dr. Okubadejo mentioned that you had to have surgery? Were you scared?
Yeah, I was definitely scared. I mean, there are a lot of things that go into surgery. It's surgery, but also I was worried honestly about my spine, but also my vocal cords. So when you think about the surgery, the disc that was replaced is between my C5 and C6, so it's right in my neck. And for that surgery, you have to actually go through the front of the neck. I was really worried if that would impact my vocal cords. And so actually, Dr. Okubadejo took a lot of care to ensure that nothing happened. My vocal cords were fine, and all of the nerves that impact your vocal cords weren't even touched.
Walk me through the day of the surgery. So describe your overall surgical experience and maybe Dr. Okubadejo's bedside manner.
Yeah, of course. So on the day of surgery, go in, basically get prepped for surgery. And Dr. Okubadejo actually came and checked in with me, and he gives the best handshakes. Can I just say, he gives the best handshakes ever. He has amazing bedside manner, and he came and gave me one of his signature Dr. Okubadejo handshakes and just checked in to make sure that I was doing okay and asked me how I was feeling. And I said, I'm doing okay. I am still really nervous about my vocal cords. He said, okay, give me a second. And he actually got a little marker and marked exactly where the nerve was on my neck, and that I knew he was taking really good care of that part since that meant so much to me. So that was really important. And he's like, I know exactly where that is. We won't go anywhere near it. And then after surgery, just walked right out the door.
So it was easy for you to walk out the door, but talk to me about the actual recovery process. What did that look like? How long did it take? Did you feel good and then bad and then good? Or was it really just smooth sailing the whole time?
Yeah, so for recovery, I mean, it's different for every single person. I think that's something that, again, it depends on what you're having done. Also depends on if you've done any kind of physical therapy leading up to surgery. I opted to do physical therapy before just to ensure that my neck was super strong for the surgery. And I think that actually helped a lot. Because it took me about, I want to say 3 days before I was up and walking around the house like a normal person. And then I was able to sleep in my own bed after about a week or so. because for the first week or so, you have to sleep sitting up at a reclining angle. And then I was back in my stage combat class after about 2 months. So I definitely am back to performing stage combat. So far, haven't really had any issues with those. I just finished a sequence on a rooftop that was a really fun sequence to do. And this next one we're going to be filming is actually going to be in a lake, which is going to be a really exciting fight sequence.
So you obviously shared with us that you were nervous before surgery yourself, and you had a wonderful outcome. So is there anything that you would like to say, any words of reassurance to anyone who is experiencing pain who might need surgery?
For sure. So first of all, it's totally normal to feel nervous. I mean, it's surgery. So just know that it's okay to feel nervous about it. I would also say too, do your research, but also don't let your research talk you out of considering surgery. I think a lot of times we can spiral on WebMD, Reddit, all these different places, and look for ways to confirm that we shouldn't do something because we're scared of it. I don't think that that's helpful. So I think it's actually a great idea to bring all of your stuff to a provider who's going to work with you in a collaborative way, so that way you can come up with a game plan that you're both on board with. So look at your options, talk to a couple of different people, find an amazing provider who works with you collaboratively, see if surgery is a good fit for you. The thing that I really loved about what Dr. Okubadejo said to me is he said, where you're at right now is pretty much as good as it's gonna get. So doing PT, acupuncture, chiropractor, and you still experience pain, that's gonna be your baseline. It will only get worse from here. There are some options we can do. Here are what they are, what works best for you. So I just felt very in control of what was going to happen and how my recovery was going to look. I actually went to 2 different spine specialists before I met with Dr. Okubadejo, and I just felt really transactional with them. I felt like a lot of it was just baseline, in the door, out the door, not really considering what life might look like for me. It was more about an appointment for them. Whereas with Dr. Okubadejo, as soon as I walked in, it was how much information can we get about where you're at and where you want to be. So we got x-rays, we got MRIs, he went through everything really in deep detail, and then walked me through everything that he found. Brought up the MRI, went through the entire thing, showed me where the disc had disintegrated, and talked about what it would look like to have a disc replacement. So again, I just felt like I was so much of a partner in my own recovery and in my own treatment. And then also too, again, he's just a lovely human. It was always great to see him, warm smile, great handshake, and he has an amazing team here too at the front desk that support him.
So we talked to a few of your patients. Let's start with Megan Farmer first. She was an actor, a stuntman. Wow, did you feel any sort of like added pressure because she actually used her body as a tool for everyday work?
Absolutely. When Megan came in, she was in a lot of pain. I knew what she did as a stunt woman. I wanted to make sure I gave her the absolute best result because I wanted her to preserve and be very highly functional. A lot of patients who have active lifestyles are often concerned about how they could continue if they end up having surgery. But if your pain limits your ability to perform, then surgery is absolutely necessary. And it's my job to make sure I deliver, that I do a good job with the surgery, and I get you back to your life. So with Megan, she came in, she had a herniation in her neck. She went through some preoperative treatment, physical therapy, injections. The pain persisted. Ultimately, came up with a diagnosis and a plan and executed, and she did great.
Megan mentioned several times that she visited several different doctors in order to make the best decision for herself. Why do you think that you were the one who won in the end, that you were the best choice for her?
My priority, other than executing surgically, is patient education. So I go through why they have pain in a lot of detail. I go through the imaging in a lot of detail. My patients and I sit side by side so they can see exactly what's causing their pain. We talk about what they can do prior to surgery, if they can avoid surgery potentially. And ultimately, the decision for surgery in most cases is a patient's decision because the patient knows what they're feeling. So my job is to really spend a lot of time educating and making it feel like it's a partnership between myself and the patient. I want my patient to go out and learn as much as possible.